Third year student, you have a clinical ortho aspect. Poliomyelitis is what is the synopsis? Synopsis first introduction, epidemiology of the poliomyelitis, etiology of the poliomyelitis, pathogenesis, clinical features, diagnosis, treatment, prognosis, and prevention. What is introduction? Introduction means poliomyelitis is the infectious disease caused by a virus. Same Greek word polio, that is grey. Myelo means spinal cord. Myelitis, that is the myelum, inflammation of the spinal cord. Where it is affected? Spinal cord is the grey matter of the spinal cord affected. Then bulbar region. Bulbar region is also affected. Bulbar means respiratory muscles also affected. Then it's often also called infantile paralysis. The poliosis is a state of eradication of the India. Last case of the polio was diagnosed in 2012. There is a polio scenario of the school children or adult people or handicapped persons. These are polio may occurs. Then epidemiology. Most common age group is 6 months to 5 years. Male is to female ratio 3:1 ratio. That is a male is a 3%, female 1%. That ratio is affected. Incidence is 2011. The 5 cases of the polio are diagnosed. Last case of the polio was diagnosed in 2012. That is Howrah, Kolkata in the year. Then the vaccine is derived from the acute paralysis are found. Etiology. It's caused by poliovirus. Male is the enterovirus genes at the Picornaviridae family. It's a 3 serotype. Bernard type 1, Leonard type 2, Lansing type 3. Pathogenesis. It's spread from the person to person, feco-oral or oral route. Then most common route is the feco-oral route. Incubation period 3 to 30 days and before and after the onset of symptoms. Portal of the entry of the mouth, then local manipulation, then infect pharynx, interstitial the mucosa, then gained by entry of the binding to an immunoglobulin like receptors, compact disc series 155 on the cell membrane, then disturb the epithelial cells of the gastrointestinal tract, then spread to the regional lymph node, enters the bloodstream through the virus, multiple reticuloendothelial cells and into the spinal cord, multiply in the neurons, degeneration of the nasal bodies, degeneration of the irreversible phagocytosis by leukocytes and macrophages affect antagon cells of the spinal cord and causing flaccid paralysis. Bones become a small joint capsule and ligaments being lax, development of the deformities. Then what are the clinical features? Mild episode of fever, headache, diarrhea. On examination of the mild neck stiffnesses are present. 2 phases of the polio, pre-paralytic and paralytic. Spinal 75%, bulbous 25%. Then pre-paralytic phase is the early phase, paralytic phase is the recovery phase, post-polio residual paralysis phase. Then the stages of the corresponding clinical features. Pre-paralytic, paralytic. Pre-paralytic is a 2-week incubation. Illness is a 2 days onset. Headache, fever, malaise, neck stiffness. There's a paralytic is a minor illness. Minor is a 2 months or greater paralysis. 2 years of the recovery phases. Most are also affected the illness 2 years of the permanent paralysis of the features of the paralysis. Flaccid lower motor neuron lesion. Lower limbs are commonly affected. Asymmetrical involvement. Quadriceps muscles are most commonly affected, but incomplete paralysis. Tibialis and muscles are also affected, commonly paralyzed. Sensory nervous system not affected. Bladder and bowel spared. Extremity lower limbs 92% affected. Trunk and lower limb 4%. Lower limb plus upper limb 1.333%. Bilateral upper limb is 0.67%. Trunk and upper limb lower limb is 2%. Deformity spine is a scoliosis, kyphosis, and kyphoscoliosis. Limb talipes equinovarus, genu recurvatum, pes cavus, flail knee. Causes of the deformities: unbalanced muscle paralysis, unopposed muscles pull from non-paralyzed muscles, gravity pull effect, poor posture, unrelieved muscle spasm, asymmetrical growth. Post-polio residual paralysis. As the recovery phase and the residual paralysis phase of the poliomyelitis start, even the intensive physiotherapy management, it was not possible to restore the muscle power. Common deformities of the post-polio syndrome: hip flexion, abduction and external rotation, knee flexion, triple deformity, general valgum, foot talipes equinovarus. Axonal sprouting. Axonal sprouting is the process where fine nerve processes grow out from the intact axon to re-innervate the denervated muscle fiber. Differential diagnosis of the poliomyelitis is the pyogenic meningitis, Guillain-Barré syndrome, post-diphtheric paralysis, acute osteomyelitis, scurvy. In the later stages of the cerebral palsy, spina bifida, myopathy, and muscular dystrophy. Differential diagnosis is the poliomyelitis, myopathy, spina bifida, and spinal disorder, neuropathy. Treatment is a broad principle of treatment to prevent deformities, to assist returning the muscle for by gradual exercise, and reduce disability by appropriate appliances by operation on joint and muscles. Okay, student, today we will see about you are a third year student. You will elaborate on the assessment part. Next year only go for PT management part.